Sir, what is the difference between the robotic and a conventional replacement?
Knee replacement. These are the So this is knee replacement implants fixed on the model. When we have to fix this implant on this, we have to create this kind of shape. When we are doing this resection by manual or our instruments given from the implant make, then it is called as conventional or manual knee replacement, which is been there from 25-30 years or more. Now from last 3-4 years this robotic knee replacement has come, in that instruments is attached to the robotic arm. This instrument kind of saw, it will help to create the bone resection and make the shape of the bone in a way which we can fix this implant. During this resection, we will look into few finer aspects, like in what angle this bone has to be resected, in what rotation this bone has to be resected, what thickness this bone has to be removed. These small and minor aspects, more accurate than our instruments are giving us information, are taken from the robotic system. So this is the difference. We use our instruments or company instruments during the surgery. We use robotic instruments. These instruments help us to give better accuracy, better alignment and better balancing of the ligaments in order to have better overall outcome for the knee replacement. That is the difference.
So how exactly the robotic knee replacement is done, sir, and
Yes.
what is haptic boundaries?
There are two kinds of robot. One is imageless, second one is image based robot. Imageless robot is we take the instrument given by the robot, we map the bone, then the system will recognize this bone and it will create a 3D virtual model, and then based on that it will go on giving the information and we will be operating. Fine tuning is done by surgeon. Of course, there is already preset data we plan during the surgery, and then we fine tune according to the requirement for that particular patient and for that particular knee. That is the difference.
So what about that haptic?
Haptic. So haptic boundary is that robot will create a boundary. So the saw will not cross the boundary.
Okay.
That is called haptic boundary. You might feel that what are the soft tissues, what are the blood vessels, what are the nerves during the surgery, will it not get damaged? Of course, surgeon will be himself performing the surgery, robot will be guiding. So along with that, if haptic boundary is there, definitely it will be added advantage for a surgeon. So he can safely operate without any fear of risk of any damage to vital structures.
Sir, according to you, who are the ideal candidates for robotic knee
replacement? Okay, ideal candidate is someone who has a grade 4 osteoarthritis, severe pain and inability to walk, who is planned for knee replacement. Any patient who is planned for knee replacement is the ideal candidate. However, if you strictly look into who is the candidate whom you definitely suggest robotic knee replacement than other patient. First, someone who has already undergone surgery and there is some screws and plates inside the bone might get into way of the surgery. Second, someone whom the deformity is very much, laxity is very much, knees like too much damaged and so much bone defect is there. Our planning of sizing of the implants, our planning of balancing will be very easy when we take the help of robot. In simple words, if there are deformities more, if there are implants already inside, it makes our surgery easier.